Are these medications enough? Or if you take them alone, are they enough to accomplish what you're looking for in terms of weight loss?
It's not just a question of taking a medication and getting the solution, that it takes much more than that. It takes really changing your lifestyle, changing dietary habits, changing your physical activity levels.
If you're on the medication, you lose weight, great. Once you stop the medication, the weight comes back because there was no real change.
Taking the medication alone has its limitations for several reasons. I personally never prescribe these medications without the program because I want to give results to my patients. Hello, everybody, and welcome back to our podcast, Let's Talk Health. I'm Dr. Benheim Albert. I'm a physician here at PhysiMed, a family physician.
Dr. Raphael Assayag, also a family physician here at PhysiMed.
And Dr. Yann Azoulay.
So this is our third podcast on weight loss, and I would like to thank you again for all your positive feedback. It's very encouraging, and today we're going to talk about a very specific subject, which is very important. So for those of you who are taking medications like Ozempic, Mounjaro, Wegovy, Zepbound, or for those of you who are thinking or maybe contemplating in taking those medications, but you don't have a structured program, you don't have anyone to look after you. So there is an important question that we should address here is, are these medications enough? Or if you take them alone, are they enough to accomplish what you're looking for in terms of weight loss? And not only that, are they enough to help you maintain it long term? Because that's a different question. It's one thing to lose, another thing to maintain. So today we're going to address this, and this is a very hot topic right now. So we've seen a massive use of GLP-1s. All these medications I've mentioned before in the recent, months and in the last couple of years. 3.5 years ago, we started this program here, and patients barely knew about it here, at least in Quebec. But nowadays, everybody has heard of Ozempic and Mounjaro. And many patients are getting these medications en passant, so to speak. Sometimes they get it online. Sometimes they just go and see their physician and say, Doc, why don't you prescribe me Ozempic? I'd like to try it. So I'd like to hear your feedback. Maybe we'll start with you, Yann, on this type of approach. What do you think? What do you see? What do you hear about simply taking the medication versus being part of a structured program?
Yeah, so I do see that these medications are more and more popular just by patients talking about it more, seeing advertising, hockey games, Super Bowl, whatever it may be. It seems like it's more omnipresent. And
Serena Williams.
Yeah, well, that
started with that.
What I find is that patients have this expectation that, if they take it, that they're just going to get the results that they're looking for, and this is potentially the solution to their weight loss or their weight issues. And oftentimes we see it ourselves, that we take the time to talk at the consultation that it's not just a question of taking a medication and getting the solution, that it takes much more than that. It takes really changing your lifestyle, changing dietary habits, changing your physical activity levels and what you're doing to make sure that it corresponds to what your actual goal is. That it's not just a question of purely weight loss, that it's really trying to put the right things in place for you to get a result and for you to have it long term.
Otherwise, it becomes just a temporary method. Once, if you're on the medication, you lose weight, great. once you stop the medication, the weight comes back because there was no real change. There was no change in lifestyle, in habits, and so your old habits come back when you stop the medication. You're hungry again, and the weight comes back. If you do, and we've talked about it in previous episodes, if we do change our lifestyle, if we take that opportunity to actually eat better and learn to exercise more and better, it's a huge game changer.
So, just for our viewers here, we have a huge weight loss program here at PhysiMed based on these medications, the GLP-1 plus a structured program to help them. So in our program, we have a lot of patients that come that have never tried the medication. But we have also patients that come to see us that have had bariatric surgery. For example, imagine they had bariatric surgery, whether a gastric sleeve or a bypass, and have lost weight, and somehow years after have put it back. And we have some patients that come to see us that have tried these meds like Ozempic or Mounjaro. I had one this morning. She came for a consult. She's been on Ozempic. She tried Ozempic for 6 months, and she said she barely lost anything. She said she lost 10 pounds, but she has like 80 plus pounds to lose. So she wasn't impressed by it. So she was referred by a friend who actually lost quite a bit of weight with us. And so taking the medication alone has its limitations for several reasons. For one of the things that we see, and I'd like to hear your opinion, is when you take the medication alone, you have X number of pounds that you could lose after, let's say, 6 months. But if you take these medications, plus you change your lifestyle, watching your diet and exercising regularly, the amount of weight that you're going to lose within 6 months is nowhere near the same. You're going to lose way more. So I'd like to hear your experience on that with your patients.
It's much more impressive than that. You're right. With the program, with the proper structure, it's not just you're not just losing weight because of the medication. You're losing weight because you're putting so much effort and you're changing your lifestyle. And often the weight loss is orders of magnitude higher than what we would expect. But not only that, it's also a way to make sure that when we stop the medication, because that's the goal, right? We don't want to be on these medications forever. When we stop the medication, the weight doesn't come back up.
So normally what we see ourselves is about 3 to 4 times the amount of weight that you lose with a medication and lifestyle change as we do here versus just a medication. What do you see from your own end?
I have the same experience too, is that I feel that patients, I seen them come in and not lose enough, and we show that, with the right guidance, they're able to lose more. I feel a lot of patients that I see tell me that they've lost weight and then regained all of it after. And I think that too comes into just better understanding the dynamics of their weight loss, of what they need to be doing, and just having the proper follow-up, having the proper guidance, understanding exactly what they need to be doing to lose weight, and like you said, to maintain that long term.
So you're touching here on the other problems that we see with the patients that have been on these medications without any kind of structure or follow-up. When what they report to us is when they stop the medication, a lot of them have regained the weight back. Versus in our program, where we have a maintenance phase to our program, our patients are not regaining the weight because we've helped them change their lifestyle. This is one key area. There is another area I'd like to dwell with, which is management of side effects. So as I mentioned in our previous podcast, about 15% of patients on these medications can have gastrointestinal side effects. That's what we see on the ground. A little bit of nausea, a little bit of heartburn, a little bit of bloating, some diarrhea, some constipation. you're not going to get all these symptoms. You may get one or two, and they're usually mild if they're well handled. And it's only for 15% of patients, and that's what we see on our ground. So I'd like you guys to talk about what you see on the ground with the patients that you treat.
That's a very important point. There's no recipe that works for everyone. Everybody's different. Everybody reacts different to the medication. When you look at the monograph of the medication, it says, you start at this dose and then you increase every 4 weeks until you reach maximum dose. That's a recipe that doesn't work for most people. Or if it does, it's maybe not necessary. People respond, some people respond stronger to the medication, so they need a smaller dose. Some people need a higher dose. Management of side effects, management of the response. You don't want to lose weight too fast either, because you don't want to lose muscle mass. So these are all things that we need to stop and reassess periodically. And that requires, a kind of structure where you're not left alone.
So for the viewers to understand, when you go see a family physician or your family physician and you ask them for a prescription of Ozempic, Mounjaro, typically speaking, you come out with a prescription that is following the guidelines of the pharmaceutical companies, which is a standardized prescription. So, for example, Mounjaro or Zepbound, you start 2.5 milligrams and you increase gradually every month up until 15 milligrams. But what we see on the ground is that it doesn't apply to everyone, because sometimes we have a patient that measures 5 feet, is 5 feet tall, another one 6'7". One is a male, one is a female, one is 30 years old, one is 65 years old, and no standard prescription. There is no one size fit all in this business. So we have to cater to every patient. That's what we do here, with careful monitoring, careful follow-up, so that we find what I call the sweet spot for these patients. And a lot of times you mentioned to me that you don't go up to the maximum dose.
So very, very rarely do.
Exactly. So all in all, what we find is I personally never prescribe these medications without the program, because I want to give results to my patients. So, and I want them to be safe with minimal side effects, if no side effects. So we have a way to manage it. And more importantly, I want my patients to not only lose, but to maintain it down the road. A lot of my patients, I played the yo-yo game, and this is where prescribing, there's a big difference between prescribing the medication alone versus prescribing it and being followed in a structured environment. So let's talk about the structured environment, because it's not just us, the physicians, that follow our patients. Our patients are followed by a team. So I'd like to hear your thoughts on the team and the impact of the team.
I want to say the team is the most important part of this. Nutrition, very important. So there's a nutritionist that's following and that's making sure that the diet is appropriate, that the patient is getting enough proteins, getting enough food, because it's you still have to eat. The kinesiologist for the exercising program, very important, crucial, making sure that we adapt the exercising program to every individual. Not everyone needs the same recipe. Body composition tracking, very important, making sure that we're losing fat and not muscle.
And the fitness tracker.
The nurse is important also to help manage. She has so much experience, so she can help us a lot with management of side effects and management of dosage of the medication. With a team like that, the doctor has a much easier job, that's for sure.
Of course, yeah. And I find that that's what really helps people to really understand it when they see their own results. They see direct feedback. I find that's really the strength of what I see with patients, that oftentimes in the beginning, it's just a lot of information. They've already come in with a lot of baggage and their own information. And what's the most helpful is seeing the actual results, seeing that they're able to do it, and seeing that they're getting getting much better results than they would if they were just on their own or if they whatever they've tried in the past.
So, moral of the story, whether we're talking about Ozempic, Mounjaro, whatnot, these are not miracle drugs. They do help a lot. They do help a lot. But they're a tool, only a tool to help you down the road. And if you use it properly with changing your lifestyle, it makes a whole of a difference. Now, talk about this with your family physician, discuss it. You need to be followed and followed properly. We found that, we need a team. It's a team approach that maximizes the results, not only for you to reach these weight loss goals of yours, but also to maintain it down the road. So there's no magical pill, but there is a magical solution. So we'll see you next week for the next podcast, and hope you enjoy the series. And also, I hope it helps you. And if you do find that it helps you, please don't hesitate to share this with your friends or family members. See you next week.
See you next time.
Thank you.